patella is referred to commonly as the kneecap. At the thigh, the patella attaches to the thigh muscle, the quadriceps, and the quadriceps tendon. Below, the patella attaches to the patella tendon, to the tibia, which is also referred to as the shin bone. The patella, in combination with the tendons and the muscle it attaches to, is responsible for normal function of the knee. It allows you to stand up, run, jump, and kick. During normal function of the knee, the patella sits within a groove. So when you bend and straighten your knee, it stays within this groove in the thigh bone. During patellar instability, the kneecap slides partially or fully out of place. Typically, when this happens, the structures that hold the kneecap in place are torn. This leaves less support for the patella and increases the risk for future dislocation. For first-time dislocations, many are treated with the standard rest, ice, compression, and elevation. We also start with a brace for the patella that helps support the patella and keep it in place. In addition, we oftentimes recommend physical therapy, which is used to help strengthen the muscles around the kneecap and support the patella and keep it from dislocating in the future. If this is the first time you've dislocated your patella, oftentimes we'll recommend physical therapy and bracing. However, if you have fractured part of the patella or part of the femur or thigh bone and have broken off a piece of cartilage or bone, we'll oftentimes recommend surgery to remove a small piece or surgery to fix a larger piece. If, however, you have dislocated your patella more than once, we'll typically recommend surgery to stabilize the patella and keep the patella in place. This is to reduce the risk of the patella dislocating again and popping out and potentially fracturing more bone or more cartilage and causing arthritis. Surgery typically involves putting a camera inside the knee or an arthroscopy to see if there's any damaged bone or cartilage to fix. Then the patella is stabilized by replacing or tightening the ligaments that hold it in place. A common ligament that is replaced is called the MPFL. Yes, though sometimes replacing the ligament is sufficient for many patients, some patients are built differently and will have variations in how their legs are built. These variations in anatomy can place them at risk for a patellar dislocation. This can include being knock-kneed or having a femur or thigh bone that is turned in. So for patients that are still growing, the ligaments that support the kneecap needs to be replaced precisely, as the ligament attaches on the side of the knee right next to the growth plate. Precise placement minimizes the risk for disrupting growth at the knee. Also for pediatric patients, other procedures, say correction for being knock-kneed, can oftentimes be done with a small, minimally invasive surgery. This is called guided growth. This guided growth in these minimally invasive surgeries can result in major correction over time. Finally, in addressing patellar instability, keeping the patella in the groove consistently in contact with that part of the femur that it sits in helps the patella and the groove develop the best. They work best when they develop together.